Welcome to Side Effects with an A. When effect is normally used, it's a noun. It's already occurred.
Effect is a verb meaning action. Action influences outcomes.
I'm Scott McGohan.
And I'm Anne-Marie Singleton. We will provoke you to think differently.
Side Effects, where problems are defined, solutions exposed. Welcome to Side Effects. I'm Scott McGohan.
And I'm Anne-Marie Singleton. We have two guests with us today, Michael Orr and Adam Griffith. So welcome, gentlemen.
Thank you.
Yeah, so Mike...
You guys said that in unison. I kind of like that.
We practice.
We do a lot in unison.
We do.
Two brand new folks at McGohan Brabender. Rather young lads, should I say. I'm allowed to say that. I'm 52, so I'm getting older.
Older than me.
And seriously.
Just a few years.
Yeah, I appreciate that.
Yeah,
and we appreciate you being here. And we'll talk about why you're sitting here in a minute. But it's fall, and that means a couple of things. One, it's football season.
Yes, it is.
And I understand, Ann, tonight's homecoming.
Homecoming football game, and then tomorrow.
You're not going to homecoming, right?
Homecoming dance. I thought about it, but
Yeah.
my dress didn't fit.
Mm-hmm.
So
You're not that young.
No. So yeah, so I've got high schoolers, and
And your daughter's going.
my daughter's going to homecoming, so I'll get the full experience of what that means.
Oh, yeah.
This weekend. So
Mhm.
we'll see. I've already had a little dress drama. The shoes didn't come on time, but I think it'll be fine.
Wow, that's a good experience. You'll
Yeah.
enjoy it.
Yeah.
You will.
I think they'll have fun. So, but fall also means that it's time to vote, right? And we've
Yeah.
got election season, even though it's not a presidential election, there's always something on the ballot in November, which also means campaign ads and ad season. So you cannot turn on the TV to watch football or the news without seeing something about how you should vote on some certain issue.
And the big issue right now is issue 2. And if you're just watching TV and you see these commercials on issue 2, quite frankly, from a consumer standpoint, it's just really complicated because it just doesn't make sense to the normal person out there is, hey, which direction should I go on this big issue 2 ballot?
Right. And I think, we were just having a little discussion before we started here. The issue 2 comes up with different names out there. And so the Ohio Drug Act, the Ohio Drug Price Relief Act. And so when you hear that, Ohio Drug Price Relief, that sounds like, hey, I'm going to get a break. I should vote yes for that, right?
Yeah, so I think starting out really from like 60,000 feet, I think everybody in America would agree that drug cost in America is just absolutely out of control.
Yeah.
It's one of the fastest driving prices inside of our healthcare system, and we need to address the cost of prescription drugs, undoubtedly. I think everyone would agree with that.
Yep.
However, and we'll talk about this is not the way to address this issue.
Right. Yes. And so that's Adam and Michael and where they come in. And so you two took an interest in this. What made you interested in learning more about this issue?
Well, actually, we started out because we were listening to another episode of Side Effects where you were talking to someone from the pharmaceutical industry about this same topic.
Yeah, Anthony Cha-Cha,
Yeah.
who's the director of the Ohio Pharmacists Association,
Right.
who's actually opposed to this legislation.
Right.
So you guys were listening to that episode.
Yes.
Yeah, we were.
Great, great.
And Mr. Cha-Cha did a fantastic job of presenting a really, really great perspective, and your discussion was compelling. And so that got me interested in why the ad space is being allotted to this issue and why so much interest is being taken in it. So we decided to dig deeper, look at the actual legislation, and then start doing some research.
Yeah, and Mike came to me. He started that on his own, and he came to me. We both have some background in research. He said, hey, I'm working on this, and so can you take a look at this thing? So I did, and I started researching it, and the more I dug into it and looked at it, the more fascinating and interesting I found it, and how important it was that the knowledge be put out there of what this is and what it does, not just those ads, those vote yes, vote no, attack ads at each other, but just what really would happen, and I found really important to do that.
Yeah, so it was orchestrated by a paid petition drive in Ohio. Mm-hmm. That's how it got on the ballot. The same thing happened in California.
Right.
And quite frankly, the media spend in California was close to $100 million of media space spend. That's a lot of money. and in my opinion, a lot of wasted money on both sides. Ohio will spend, they estimate, about $60 million talking about both sides of this
Right.
issue. And at the crux of it, the sounding board of this is that in America today, if you're an employer, a consumer on Medicare, basically we all pay about the same price for prescription drugs, relatively. There's some differential. The only entity in America today that gets a pricing concession would be the Veterans Administration, which would be different. So the position on this issue too is, hey, we want the same price as the Veterans Administration. And so from a public eye, it's like, hey, that
Right, it
that
makes-
would be a great idea.
It appears to make sense initially.
Initially.
Right. But what happens when you look a little bit further into it?
Yeah, the thought is wonderful. That sounds great. But when you really look into it and dig into how the VA gets those reduced prices and why their costs are lower, you start to see that it's because the VA operates differently than any other state entity. And Mike did a lot of research on this.
Yeah, we looked at the way that prescription drugs are bought and sold, and we looked at the structures. There isn't actually just one avenue that companies take to buy and sell drugs. It's a varied process, and the VA has more of a direct to consumer system where they're actually, the system itself is that the VA buys the drugs and then distributes them themselves. Whereas most companies, most employers, and most pharmacies are going through a system where they're working with PBMs or pharmacy benefit administrators and working to put men in the middle there. So there's an increased cost. And there's also more negotiations going on.
Yeah, so from the average consumer, there's a lot of logistics in a retail transaction.
Right. And we've talked about that.
We've talked a
in
lot
other
about
episodes.
that. And so what you're saying is this logistically, it's just the VA making a transaction and then they distribute the drugs.
Right.
Right.
Now, here's the issue. So we have this issue right now in America, and it's in our healthcare dollars. Because Medicaid pays, on average, a very low percentage of cost in regards to healthcare. Medicare pays slightly above that. And then the private sector, if you're a self-funded employer, a fully insured employer, if you're a consumer under an
Right.
HSA and you're paying the cost of healthcare, you're paying the most inside of our healthcare system.
Right.
And it's like a balloon. So because the government doesn't, in the healthcare system's eyes, doesn't pay their fair share, the only way to get their cost is to push that balloon out and you and I absorb these costs.
Right.
What people don't understand is if this is passed, we're going to do the same thing.
Yes.
Right.
Exactly.
We'll see it increase.
Right, and there's a wonderful kind of case study example of that from the 90s, the OBRA, which was on a federal level, where they tried to say if one state agency pays a price for a drug, then all state agencies must pay that price. And the result of that was actually fairly predictable and rapid. They increased the price of the drug to the highest price available. And that's kind of what happens when there's no mandate on the drug manufacturer side to meet the benchmark that is set. So they had to rectify that over several years and costly legislation and research to add another bill to mandate that they meet that with a particular 24% discount.
Right. And so one of the things that I think you had in your studies had come up with, and I read this, and so correct me if I'm wrong, is that some of the drugs that are being used by other state agencies or in, public employer plans or even in private employer plans are not the same type of drugs that are being used through the VA. So drugs to treat children or some specialty drugs may not be things that are being used there. And
Absolutely.
so those then aren't subject to those quote unquote price controls.
Right.
And it creates a gap because if you're using this one list of formularies to, regulate all industries, if they don't cover children's drugs, pediatric drugs, how do you then, it has nothing in the legislation to address that. So it creates another problem where you would have to then go back and make additional legislation, and it becomes a rolling process. They did not expand the bill enough. It's only 5 pages long to go into the depth necessary to address the vastness that is controlling drug pricing in Ohio.
Yeah, so we wrote a white paper and we put it out on healthierbirthdays.com a while ago. That the title of it is Hood Robin.
Right.
I think we all know what Robin Hood did. And unfortunately, the pharmaceutical world is the reverse of that. And it's a problem that we need to address in this country. And we've stated this is not the way to address it, because quite frankly, we're all going to pay more. But what's really interesting in looking at this legislation, number one, if it's passed, it's almost, I almost said impossible. Let's not use exaggerated words. It's very difficult to execute.
Yes.
Yes, the language makes it very hard. There is no definitions of terms. It actually creates an entire new chapter of Ohio law in the Ohio Revised Code. So it can't refer back to other definitions and other chapters, and it doesn't. So terms like drug or prescribed drug are undefined, which have subtle differences in other areas. So that make large impacts in how things are implemented.
Right.
Yeah, because you should never vote based on a television commercial.
Right.
So there's a quote, and I love it. It says, "Ignorance is not the absence of information, it's the perception you have it."
Right.
So these ads that are coming out, they're giving us information, but obviously on both sides, it's one-sided.
Right. It's very biased based on whatever 2-minute clip you saw.
Yeah, and a lot of people really want to go live their lives. Like, you want to go help your daughter tomorrow go to homecoming. You don't
Right.
want to read about issue 2 and whether you should vote on it or not.
Right. Right.
And we're talking about 20% of our economy, so to try to understand that in a short period of time is virtually impossible.
But it's really important.
It's really
So
important.
that's the reason that we dedicated yet another episode of Side Effects to issue 2. I think this is the third one that we've done related to issue 2, because it is difficult to understand. It is easy to vote a way that you didn't mean to vote. And in no way, shape, or form are we telling people how to vote. We just want you to be informed with your vote. And finding out where to go to get that information and really understanding what this means. Again, it sounds to the general public and to most people, education level is not on the table here. It's just drug relief sounds good, right?
Well, not only that, but the drug manufacturers are actually paying for a lot of the ads.
Which automatically would cause you to
Yeah.
go the other way.
You would
Like,
say,
I'm not
"There's no way I'm
want to
voting for
support
that."
something the
Absolutely
manufacturers
not.
are supporting. But you guys were talking to me earlier about this group of people that have come together in opposition to this bill. And so talk a little bit about that.
Yeah, there are over 60 organizations and associations as of right now in the state of Ohio, including pharmacists, medical providers, veterans organizations, all coming together. People that you usually don't see on the same side of the table in the same room are all banding together in opposition of this bill, because they can see that the impact that it will have will affect all of them negatively, and it will affect the citizens of Ohio negatively in their ability to control the price of drugs.
And not only control the cost of drugs or the price of drugs, but in some ways access as well.
Absolutely.
Yeah.
Yeah, so if they can't meet this new mandated benchmark, then the state agencies will have to find other ways to make those cuts, and that would be reduced formularies, higher costs to health plans and to members. It would be what they would be forced to resort to.
Yeah, make no bones about it. I mean, McGohan, Brabender, and our mission or vision is empowering business with solutions, empowering people with choices. And we know there's a significant prescription drug issue in our country, in our community right now.
Right.
And we need to address it. This is just not the right way to address it. And we would look at the number, and you brought this up, Michael, the number of people that support this legislation or say vote yes, to the best of my knowledge and all the sources I've looked at, I can only find one. And the list of people that are opposed to this legislation, including the Ohio Chamber of Commerce, including the Ohio Pharmacists Association, including the Ohio Nurses Association, I've got a list of, including the Ohio State Association of Veterans Services.
Right.
I mean, the number of organizations that are opposed to this legislation is overwhelming and significantly compelling.
Right. It's
to this issue.
It's something to look at, and it's something to be informed about. And really, you know, every year when I stand in front of employers and employees and we talk about, you know, health plans and legislation and why there's certain changes to a plan and how come I can't have this or how come this is expanded, and if they don't like it, the best thing we can say is you have to vote. You have to vote. And in some ways, in many ways, that's how we get things done in this country, right? And so I think a lot of people don't go and vote because they don't understand the issue and they don't want to make a mistake, right? Or vote a wrong way. A lot of people do vote because they feel like, hey, this is my right and I want to stand up and I want to do something. And they still don't vote the way that they meant to because they didn't understand the issue. So what we're talking about here today is know the facts, understand what this means, understand who's for it, who's against it, how it's funded, why it's here, and the impact it could have to you, to your family, to your health plan if you're a plan sponsor. I mean, this cannot end up well for your cost in terms of reducing them in any way if it passes.
I think personally too. I mean, one of the things, and you're exact. I mean, we should be grateful we live in a country where we have the right to vote. Personally, Scott McGohan is not going to vote for this legislation.
Right.
I don't know where you are.
Yeah, I'm not going to vote for it either.
So, I mean, what we don't want to do is say, please vote no. No, we're saying that's an individual decision. What we are saying is, God, by golly, get really informed if you care about this issue. And it's that important, because if this passes, there is no question about it. In the state of Ohio, we will pay more for prescription drugs than other states, and that will affect our local economy. So as we wrap up, Michael, Adam, one is thank you for being really curious. I think it's one of the greatest traits on our planet, is for people to be really curious. So I bumped into you in the hallway. We were talking about something, and I recommended, hey, dig into this thing. Tell me what it's all about. And your background is?
Academic research.
Right.
Yeah.
So you guys research, right?
Right,
And you
yes.
provide arguments.
Yes.
So you wrote an incredible white paper on this. Both of you guys did. Very impressed by the content
Right.
and the feedback and the color. And then as we conclude, too, being a 52-year-old, I look at you because one day you're going to have to run this place or this country.
Right.
And
We're super glad you care.
I'm super glad you care.
Yeah.
Because you're going to have to pay for our Social Security one day.
Right.
Yeah.
That's real soon.
I'm going to get there faster than you.
Sooner than me. Right.
So join us. Look at healthierbirthdays.com. We'll put resources out there in regards to Ballotpedia has a great white paper on this issue specifically.
Yes.
Right.
Information in regards to Hood Robin. Thanks for listening. Thanks for joining us. Good luck at prom tomorrow night. Have a great day.
Thanks.
Thanks for listening and opening your mind. If you're interested in learning more, you can reach us at scott@healthierbirthdays.com.
Or Ann at healthierbirthdays.com. We hope you'll join us next time
On Side Effects.